Each year, 35,000 Canadians suffer a hip fracture. The consequences can be catastrophic: permanent disability, loss of independence, even premature death. 9% of men and 5% of women die within a month of a hip fracture, and up to 35% die within a year. The economic burden is major too, with estimates at more than $1 billion a year. Fortunately, there's promising new research underway. The Hip Attack trial at the Population Health Research Institute and McMaster University will examine if accelerated medical clearance and operating room access will improve post-operative outcomes for hip fracture patients. With 10 participating hospitals in Ontario, the trial sets out to determine whether surgery within 6 hours of a hip fracture diagnosis will lower the rates of heart attack, stroke, embolism, infection, bleeding, and even death. Study investigators also believe that rapid treatment of hip fractures may shorten hospital stays, help patients maintain independence, return to their own homes, and improve their quality of life.
We're hoping that rapid treatment of hip fractures will rapidly correct the underlying physiological abnormalities. Hopefully we can then mobilize patients within 12 hours and get them back to their normal physiological state in a very rapid process.
They told us what was going to happen, and everything they said that was going to happen was going to, and it gave her something to look forward to. Okay, the next step is this. At this time, they're going to get me up. At this time, I'm going to take some pain medication, and then physio is going to be on me. And everything they said that was going to happen did.
Support from the Canadian Institutes for Health Research Strategy for Patient-Oriented Research and the Ontario SPORE Support Unit have enabled the Hip Attack team to realize meaningful patient engagement.
The sooner we can involve patients, both instrumentally, that meaning in the day-to-day governance of our work, as well as strategically in how we'll move forward, it helps us to better design a knowledge translation plan to disseminate the results of Hip Attack.
The Hip Attack team believes that with research comes the responsibility of sharing information and making decisions in collaboration with patients and their families. The team is implementing 3 key patient engagement strategies that reflect commitment to patient engagement and ensure that data collection and trial outcomes are relevant and patient-centered.
It's the way of the future, I think, of research, so we're really glad to be on the forefront of this.
Patient governance auditors work with the team to promote transparency and accountability. They verify and record research-related decisions in plain language so everyone stays informed. Through an interactive voting system, patient representatives tell us what outcomes matter most to them. This informs working with our data, knowledge translation, and future study design.
The team has impressed me. They do listen to our input, not just me, because there are other patients as well. But with our input, good or bad, they'll take it from there with those information, and then they could go forth.
We know that getting the word out effectively means hearing directly from patients about the work we're doing. With Word on the Street videos, our patient team members can be seen and heard by the broadest audience possible.
And it really helps people to relate to the science by hearing it from someone else who's like them.
We see patient engagement as our collective responsibility. We're making it happen together.